Can you tell us what are attachment styles and how we as humans begin to attach ourselves to other humans?
Well, we begin to attach ourselves to other humans by how we attach ourselves as an infant to our primary caregiver. So when we are born, we all we can do is cry. We can't do much of anything. And so it is the daunting task of new moms and dads and all the other caregivers of infants to try to figure out what is going on. So in order to do that, you have to be responsive when the baby cries. You have to be available to the child, to the infant every time it cries. And you have to, on some level, be engaging. And so it takes all those three categories, and nobody gets it right. Like there's no such thing as a perfect childhood. There's no such thing as perfect anything. But what the beginning task of you as an infant is for somebody to try to figure out, because you can't talk, you can't write things down. Here's what I need. So you need to have a responsive, alert, empathetic caregiver there that can respond to your needs as an infant. So usually you're hungry, you're tired, you need a diaper change, you just need stimulation, or there's too much stimulation. And the task for infants and for parents who are raising infants is to try to try to regulate the child. Because imagine if the baby can't tell you I've had enough stimulation, all it can do is cry. And what do? You pick the baby up and you regulate for the baby. You calm the baby down when it gets overwhelmed with things. And so eventually, after infant is in a situation, and really infant is from 0 to 4, those are the critical years, where that child needs somebody who's able to adhere to what they need. And when you have someone who's fairly able to attend to you, to give everything that you need from 0 to 4, what you come out of that with is a secure attachment. Okay. And so if you have attachment disruptions at early age, if you have someone who's not able to attend to you for whatever reason, maybe you have a primary caregiver who's sick. Maybe you have a primary caregiver who's on drugs, or somebody for whatever reason is not able to respond to you appropriately. Then you have what's called insecure attachment. So that's attachment styles in a nutshell.